She was supposed to have her left adrenal gland removed, and the surgeon accidentally removed a portion of her pancreas.
Jesus.
I'm like, okay, maybe anatomy. Did you like not get a good grade?
Okay,
there?
to be fair though, is like when I do see videos of like surgeons doing stuff in the body, it isn't very like clear cut in there.
They're not labeled.
No, there's no labels. It's not very clean in there. There's blood and guts fucking everywhere and organs popping out. I mean, it's a very compact space in there.
Okay, that's how it looks to us.
Yeah,
but
fair.
again, this is a doctor who's, if he's a surgeon, he's used to digging around in there. And even surgeons are very specialized. I mean, they should know a pancreas from an adrenal gland.
Yeah.
Prioritizing profits. Prioritizing
Dangerous drug and product cases.
Welcome back. Another week, another episode, prioritizing profits, dangerous drug, and product cases. How you doing? How you feeling? Real quick, for anyone that is watching, as you can see, there is a very golden 50 next to me. It is our 50th show. We're almost to a full year now.
Woohoo! Yes, 50 shows. 52 will be the 1-year anniversary, so rest assured we plan to celebrate that as well. But 50 is like a big one, and 50 in anniversary is when you receive gold presents. So there's, I don't know if you knew this, this is a very old traditional thing, but for each year there's something, you're supposed to give a gift of a particular type, and you have to wait 50 years to get anything gold.
Well, and the person receiving the gift, I'm assuming, is the woman.
Well, maybe both.
Wow.
So in the first year anniversary, it's actually paper. You're supposed to get something out of paper.
Paper? Wow, I think
kind of
Christina
flimsy.
might break up with me, or might have broken up with me first year if I got her paper for our, just like a Dunder Mifflin block of paper.
I don't think it's just like a stack of copy paper or anything. I think it's, something made out of paper, perhaps a
Origami.
card. Origami would be more creative, something along those lines. But it seems, and then I don't know what all of them are, but there's like wood and steel and silver at some point. But I mean, literally 50 years to get to gold. There are people who have been together 50 years, married 50 years, but not that many.
I mean, it's a good excuse to hold off, I guess. Trust me, I really want to get you a gold anniversary gift, but it's just, we're 49. It's not 50 yet, sorry.
Hold in there one more year.
Exactly.
Well, we'll be celebrating our paper anniversary in 2 more episodes.
Yes. 50 shows, though, 50 weeks, that's crazy. Insane.
It is.
I know we were talking about it in the early days, and a lot of podcasts kind of just die off within the first 5-10 episodes.
Oh, yeah. Well, I don't remember what the exact stats were, but I mean, they're just, millions of podcasts, but like the vast majority of them have like 1 or 2 shows, and that's it. And obviously some do really well and last for a long time. But even just the ones, where I'm searching for a topic I like, I find them and I'm like, oh, that's cool. And then I see the last one was like in not in the 1900s.
Holy.
Okay,
they
it's
were one of the
like
first.
2021 or 2022. And I'm like, oh man, that's kind of a bummer because I know that the information won't be totally up to date. But we're hanging in there. 50 is pretty exciting. And in fact, we're doing this 50th on a Saturday.
Yes.
Not our usual schedule because Ben will be traveling, and he is so committed to this podcast and its success that he made an extra trip to cram in an extra podcast so that you will not miss us for a week.
A necessary sacrifice, I must say. But I love doing the podcast, and it worked out well because the street fair is today in Tucson.
Yeah.
And Christina's never been, and it's been very long since I've been. And I've had a more of an appreciation towards street fairs and farmers markets, swap meets, like all of those type of events. Like I have more of an appreciation now as an adult because I don't know, I actually use most of this stuff in there. Before it was like, well, they better have Pokemon or Yu-Gi-Oh cards, or it's a bust. It's a bust if they don't have trading cards.
I do recall. Although, lots of the booths have like toys and things for kids. I mean, there's entertainment. Peter actually has played at several of the street fairs. And then, of course, all of the restaurants and bars along there are open up. It's a big day drinking opportunity for those who partake. Yeah. But it's just nice, too. I mean, there's people come from all over the country for this. It's one of the really big ones. And
all over the country?
All over the country.
Really?
Yeah. Well, I mean, so a lot of these people who do these fairs, I mean, they're kind of nomadic anyway. I mean, there's a lot of like van life kind of situations, right? Where they go, from state to state and follow the weather, quite frankly, because in a lot of states, you could not have a huge outdoor festival, even now in March. I mean,
Yeah.
it's snowing in parts of the country. And so a lot of these people, where this is their full-time job, I mean, they're selling their artwork, their crafts.
Well, I'd imagine the long-term goal is to go to these fairs, these markets, sell your items, and then hopefully build up a customer base that are just ordering online, so you don't have to do that active salesman.
Yeah, I don't know. I don't know if that's the case or not, how many of these people really do sell online. I mean, a lot of things are, like the body scrubs and the soaps and the spices and all of that kind of stuff. And I just don't know that I would pop online to order some.
No, you wouldn't, but you would get one at the market and then
Yeah.
reorder it online.
Maybe. I mean, I have, the one that I have, the one experience I've had with that was when I was in Sedona, and I really like honey in my tea, and they had these amazing, like, flavored honeys. And there was like a chocolate whipped honey and pumpkin spice and cinnamon and all of that. And I think it was like 3 for some special deal. And I went through those. I was like, I've got to track this down. And so I have ordered from them several times. Not something I've seen a lot, but then more recently when I was in Bisbee, I found a place that was doing a similar kind of thing. But mostly, more often than not, I don't. I mean, lots of jewelry things too, you'll see.
Yeah, I don't really want to get jewelry at street fairs.
Some of it's very nice. And, I mean, Christina's with you, and she may see something she likes. I mean, actually.
It is expensive.
Well, she is expensive and well worth all of it. But the fact of the matter is, there should be something to commemorate her first street fair. So I'm just throwing that out there. I mean, no obligation. Although she is listening, so there might be a little bit of obligation or expectation.
Quite a bit of expectation there. We when we went driving back from New Mexico or to New Mexico, we got beef jerky, and then ever since then, I've ordered beef jerky from that. Like, it's like a random shop in the middle of nowhere, in between Tucson and New Mexico.
Oh wow!
So I've ordered from there a few times, and then at the farmers market, there's a dog beef jerky that Bruno's obsessed with. Absolutely loves it, and he is a very picky dog. It is.
Yeah.
Because you can get him to eat something eventually, but for him to consistently want that treat, it takes something unique. It takes something truly unique, because I don't know, he likes meals. He likes big meals. He doesn't like small little treats. It's a waste of time for him. So beef jerky he really likes. The last time we ordered, we got a pound of it, and it's been essential for getting him his medication.
Nice. Yeah, I hadn't thought of beef jerky. Well, I'm just not a jerky person, I guess, so I can't imagine.
Well, it's low-cal protein,
High protein. Well, and I will tell you that there is always beef jerky at the street fair, so you may get hooked up with another kind today. So we're excited about that.
We'll definitely give some updates and maybe some hauls, some shopping lists of what we've achieved.
Yeah, we can get some shout outs to some of these, local, or not necessarily local, as I said, but small business vendors. It's got to be kind of a tough life. And I always, and I always do really like when you can support a small business, with more of the homemade products, rather than the Walmarts and Targets of the world.
Yeah.
Amazons.
When I order the beef jerky from the place in New Mexico, they always do like a handwritten note thanking me for the order, and it makes me feel nice inside.
No, it just reminded me. So one last, and really we will get to legal stuff eventually here, but the last time I was at the street fair, I bought Peter a bracelet that was made out of guitar strings.
Oh.
Yeah, it's actually very cool and very manly. But I wasn't entirely sure he'd like it, but man, he loves that thing. And he wears it all the time. I mean, he has, I bought him this beautiful David Yurman bracelet years ago for some anniversary, and he will wear that with his tuxedo or suit or something like that. But I mean, this guitar string bracelet he has worn.
That seems down his alley.
It was very unique. I've never seen anything like it. So I have to, and he's not going with us today. He didn't go the last time, which we're not leaving him out. He's happy not to, not to be going, I think, unless he was playing music. But I might have to find some little gifty for him as well.
Well, we'll keep an eye out. Getting into the show, I know we're a little bare on updates on cases. Where did you want to kick off today?
So what I thought we would talk about today, and this is not a drug or product. However, drugs and products are often involved. What I thought we'd talk about is medical malpractice cases. And I have to say that in all the years I've been practicing, which I think is pushing 36 now, the number one most likely, most common call that we get are potential medical malpractice claims. And I think there's probably a number of reasons for that. I mean, everybody sees doctors, and, everybody dies.
Yeah,
And then
die.
a lot of times there are bad outcomes, which doesn't necessarily mean that the doctor has done something wrong. But and also, I think one of the biggest reasons we get calls are the doctors can be real assholes sometimes, and I think that they're just, so many times it's just, honestly, I think it's a case of the doctor being rude or inconsiderate, very brusque with their patients, not a good bedside manner, and it pisses the patients off, and so then they want to be calling a lawyer. But I have to say that, I mean, and really the questions we get, more often than not, they are related to medical malpractice.
And before we get too much into it, can you give us like a quick definition of what medical malpractice is for anyone that might be unfamiliar?
So medical malpractice basically is when a doctor or healthcare provider falls below the standard of care, and is basically that's another way of saying is negligent.
Yep.
And the interesting thing about that is that the standard of care, well, first of all, that's going to vary from practice area to practice area. But basically, it's what should a doctor, what's the basic level of competence that a doctor should have in a particular area, a particular procedure, whatever it is, and did the doctor meet that? And what I think is a lot of people don't understand is that doctors don't have to be like A+ doctors.
Yeah.
They just can't be D doctors.
They just can't be negligent.
Right. I mean, they have to meet the standard of care that's expected in the community from providers in that area of specialty. What would a reasonable doctor do under the circumstances?
And I'm assuming that's one of the reasons that you get so many calls about it. There's a lot of confusion and a lot of people kind of looking to go down this alley is because it's a very subjective area, right? Like when you're talking about standard of care, what exactly is standard of care? You're using a lot of like referencing kind of local areas, local similar fields of work, and then also negligence. Like what is negligent? And that's what all these cases really are going into, right? Is like this very subjective idea that there isn't a defined definition per se. But you can obviously get expert witnesses and colleagues in there to try to build that story.
Yeah, I mean, I think, well, so for the standard of care, if you're going to bring a case against a doctor, you actually have to have another doctor in that same practice area who's willing to come in and testify that what Dr. A or Dr. D, who's the defendant, did fell below the standard of care. But what will usually happen is that doctor will also hire, as you said, an expert witness or a doctor who comes in and says, oh, no, that is within the standard of care. And then it's ultimately up to a jury to decide whether or not the doctor did fall below the standard of care, whether or not they're liable for medical malpractice. These cases are, they're hard to prosecute. They're very, very expensive to prosecute because they're expensive to prosecute and to defend.
Oftentimes, I'm assuming you have to take this to trial, which is what makes it so expensive, right? You have to get those expert witnesses compared to other cases where there's like a good chance you settle before.
Yeah, well, there's so many reasons why these are difficult cases, and there's so many reasons why a lot of attorneys simply don't take malpractice cases. But like I said at the beginning, the number one most common call we get is medical malpractice. And I think the very first thing is that it's important to realize that just because you have a bad outcome doesn't mean that there was malpractice. And I mean, there are plenty of situations where people get horrible diseases that simply aren't survivable. They have injuries that aren't survivable. All procedures have risks of complications, and complications can happen while the doctor is following the standard of care.
Doing exactly what he's supposed to be doing.
Right. I mean, bad shit happens sometimes. And so there are a lot of cases where that's the situation. But kind of starting from the very beginning, when somebody calls an attorney and believes that there's been medical malpractice, the attorney has to decide, okay, am I going to invest the time and resources to investigate the case? And so probably the number one question is, what are the damages? What happened? happened.
Yeah. I was going to ask, like, what's the most common type of medical malpractice? Is it just surgeries? I would assume so. But I'm assuming there's obviously, like, this can be almost anything because standard of care, depending what type of doctor it is, what type of care it is.
Yeah. Well, actually, and I don't know what the number one would be, but when you think about it, there's so many different areas. I mean, there's complications that happen in surgeries and some crazy shit, like where they cut the wrong leg off, they amputate the wrong leg.
Crazy.
All right. I mean, it's crazy things like that.
That's pretty malpractice.
That's pretty obvious malpractice. But then there's, plenty of other circumstances where there's bad outcomes. But then if you think about it, one of the one of the big cases is failure to diagnose, delay in diagnosis. And you see that a lot, like with cancer cases where somebody, they have their mammogram, they have whatever test that gets misread, something gets missed, they go another year, and then they had this gap in time where had it been diagnosed timely, they would have had a better outcome. So in those cases, you actually do have to establish that had it been caught, it would have been a better outcome.
And it was possible to have been caught.
Right. That it should have they should have either done the diagnostic tests, they should have evaluated the results better, and had that happened in a timely manner. I mean, there are situations where people they mess up the records and they give the wrong person the diagnosis, and then the other person's not getting treated. I mean, there's all kinds of situations. But I mean, I've had many times where patients have come and they've said, I have, this kind of cancer, I've done all of these mammograms all of the years, it wasn't caught. I want to get those and have an independent radiologist look and see should they have caught that. And there was a really, really sad case several years ago that we looked into, and she had a very aggressive form of cancer. And they looked at all of the mammograms, and mammograms they're not ideal. They catch some things, but they certainly don't catch everything.
I was going to say, I mean, with x-rays and mammograms, I mean, there's it's a lot of interpretation, right? Because you have to have the doctor look at it. And when I get explained, like I've had x-rays done, right? I'm sure everyone has had x-rays. And when you get explained it and they're like, you see this like fuzzy little white dot here in this crevice, it's like, yeah, but there's fuzzy white dots everywhere, right? Like,
but radiologists should know which fuzzy white dots are.
That's fair. That's fair. They obviously know more, but it doesn't seem always so clear cut. And so when there is that risk, that fear, pressure that maybe, you're unsure and you don't catch it, or you just, you're unsure and you don't know which way to go, and it ends up being the, cancer route.
Yeah, well, and I think that in those circumstances, really the argument is that you should always err on the side of caution. Yeah. And if there's something that's at all questionable, you want to say this is questionable, send it back to the doctor, and let them pursue further testing or make that call at that point. And one of the concerns that you hear a lot about is that these the radiologists are sitting there reading report after report after report after report. How many hours a day? Yeah. Are they getting up?
I mean, they're humans, right?
They're humans, and humans make mistakes.
Yeah.
And so, perhaps there should be a protocol of having two people put their eyes on it.
I mean, that's a tough thing, right? Is like malpractice really revolves around making mistakes. Like, did this doctor make a mistake that could have been avoided, that is unreasonable to make? And as much as we would like to envision doctors being this like almost perfect embodiment of medicine and caretaking, they're not. They're humans. They have wives, they have kids, they have, depression and anxiety and all of these other things.
Addictions.
Yeah. And sleepless nights, all of these like normal problems that everyone has to struggle with. But when they show up to work, they're expected to pretty much drop all of that. Like, all of that just gets left behind, and you need to be top of your game, A game.
Right. Well, and I think a lot of people have historically treated doctors as gods. You know, I mean, the know all, be all, and everything. And I will just say that being married to a doctor, they're not gods. I mean, they're close sometimes, but but not gods.
So I mean, that's a good point, and I'm curious about is, have you had a medical malpractice cases that you've brought to Peter and talked to about, or has he had situations that he's had to come to you about, or maybe some of his peers that have discussed it? Because you guys have a very interesting dynamic, right? You don't usually see many heart surgeons and lawyers getting together, and I think it's very relevant, right, to this medical malpractice conversation.
Well, sure. I mean, we discuss things. I mean, luckily, Peter has never had a malpractice case.
Yeah.
He's been practicing probably as many years as I have,
impressive.
over 30 or so. But certainly, we talk about things, and he has been retained on a number of cases as somebody who would review medical records of other electrophysiologists and render an opinion one way or the other. And he's very unbiased. I
Yeah,
have
he's
to
a pretty
say.
high value expert witness.
Yeah, I mean, he is. He's very, well known in his field and has a ton of experience.
Hotshot.
He's a hotshot. I'll go with that. It was actually funny. I was telling him the other day. I said, you should listen to our podcast more often because you do get some airtime. So anyway, yeah. So shout out to Peter. He's getting some more airtime here. But he's very objective, and just the fact that he's married to a plaintiff's attorney, he is not swayed by that. Believe me. I mean, he says. I mean, he gets the records one way or the other. He says, yes, I think this is below the standard of care, or it's not, or it's a close call. And the important thing too is that so when I'm an attorney and I have a case and I don't understand the medicine, but I need to know if it's a case that I should be investing my time and my money in getting the client's hopes up and all of this. I want an honest opinion. I don't want somebody to just say, yeah, it's a great case, and then you find out, 3 years later that it's not a great case and you're, losing all your time and your money. The client's disappointed. I mean, really the best thing that, that a witness and an expert witness, who's evaluating a case can do is just be really honest about it. And sometimes, and again, even some of these situations, I mean, and he's told me some, when he's had to testify, I mean, there's some pretty extreme things and they always find somebody on the other side who says, waiting 5 minutes to start compressions isn't a big deal. Like, oh, really?
I mean, you can find an expert witness to say and do anything, right?
You can, but unfortunately, the thing is that you don't want that.
No, you lose value. Like that's why Peter's such a high value expert witness, is because he's stuck to his guns. There's a lot out there that just will flip flop, whichever way the wind's blowing. Pete, he sticks to his guns, and for anyone unfamiliar too, I had no idea about this, but when expert witnesses go on in trial, go up on stand, and they're getting cross-examined by the plaintiffs, the attorneys can actually bring up previous cases where they have testified and they were expert witnesses, and especially if it was in the same kind of realm, maybe similar condition, similar problem, you can really get them, tripping over themselves.
Absolutely. And that's the thing too. I mean, so Peter does not, I mean, he does these cases, but that's not his career. That's not his focus. I mean, his focus is treating patients. There are doctors, however, who have decided that they can make a whole lot of money being basically professional witnesses. And so most of the time they're testifying. And so then there's like hundreds and hundreds of cases and they can't remember what they said. And they're also, if that's their business, I mean, they're saying whatever the person who's paying them the highest amount of money wants them to say. And so they may say conflicting things in cases. And so so one of the things that we would do is find all of the depositions that they had given previously, which could be very tedious. And like a lot of plaintiffs will share those, in my case, I have this deposition. They're actually deposition banks that are collected on doctors. So, the ones that are testifying a lot. And so then you can go through all of those, and it is kind of fun when you find out, it's a really similar case over here, and you kind of said the opposite. And that's really important, as far as disputing their credibility and supporting your side of the case.
So it's interesting too on the perspective of the attorney, where the way that you approach these cases, I would imagine, are completely different from typical, mass torts, MDL type of situations. And those, oftentimes you're going to these conferences like in Vegas and whatnot, and they will kind of explain the case, right? They have experts there. They're giving you the lowdown. They're telling you why it is a good case or why it isn't a good case, compared to these where you have individuals reaching out to you, giving you a very unique experience in case that you may have no experience on. You may don't have experts ready on hand, right? And so there's a lot of individual responsibility on the attorney to do that research, learn about the actual case and the condition and where the malpractice happened, but also the expert witnesses if it does go to trial, and doing all the background research for that.
Well, absolutely. So in these bigger cases, I mean, the medicine has already pretty much been done for you. I mean, those initial cases, they hired the expert witnesses, decided, yes, this is an issue with, this product, this medication, whatever the science is already done. And then you just simply need to find people and and ensure that that applies to their case as well. But so these cases, and again, one of the reasons why many people don't take them is that they are super expensive. So right off the bat, somebody comes in and says, "This happened to me. I think this doctor screwed up." You can look at the records. Sometimes, well, first of all, damages. So even assuming that the doctor did screw up, what's the result?
Yeah.
I mean, and there has to be a pretty significant injury, because otherwise you're going to spend probably minimum $100,000 getting this case worked up into trial,
Crazy.
oftentimes more than that.
Yeah.
And so, if it's like, well, it took me longer to get better and I missed a few days of work. No, that's, I mean, again, it might be malpractice.
You might have been done wrong, but it's just not.
But there's not sufficient damages to bring the case. And even when the damages are say $25,000, $50,000, again,
You don't want to just risk breaking even.
right. Well, and nobody wants that. Nobody, the clients doesn't want to go through all of the hassle and testifying and all.
They're not going to get any money.
and not get any money. The attorney to maybe break even, because here's the other thing. More often than not, verdicts go in favor of doctors. Juries hate finding doctors wrong.
That makes sense.
They love doctors.
Well, it disrupts their vision of reality, right? Like doctors
well,
are
their
supposed
sense of safety probably
Exactly.
too,
Yeah,
and
exactly.
just their confidence. So yeah, I mean, so you've got to have big damages, and you've got to have a pretty good idea that is something that's extreme. It's not going to be really nuanced, where it's really a close call. I mean, you need to have the jury say, yeah, that really is a big screw
cut off the
up.
wrong leg type of.
Yeah, those cases are pretty strong cases,
Yeah.
for sure. And we'll kind of talk about some of the other really extreme cases. But yeah, you have to have enough to have it make sense. I mean, you're going to spend a lot of time, and $100,000 minimum. And again, that's the attorney's money. I mean, in theory, clients could pay the costs, but I don't know any clients. None of my clients ever have, and none have ever been willing to. So,
Yeah.
so you're going to advance that cost. You might lose them, and it's going to be very time consuming. And more often than not, they don't settle. We talked about that a little bit. That
Yeah.
many of these mass torts do settle. The issue here is that it's very personal to the doctor.
Yeah. Ego, and it's your personal career. And that was kind of going to be my next question, is before we get into the specific cases and your experiences, what is this like on the doctors on the defense side, right? Like, what if they are found guilty, what happens to them? Is there a bar association similar to, for doctors, similar as there is for lawyers? What does that look like on the back end?
Right. So there's a board of medical examiners. And so, yes, that they regulate the doctor's medical licenses. And there is a potential under circumstances to have your license revoked or suspended, or letters of reprimand or sanction can be issued. So it is very critical there. One of the things, so in a regular, say, car accident case, if the defendant, so the driver who causes the accident, they don't have any say over whether or not the insurance company settles. The insurance company can say, you know what, I don't think that this is necessarily your fault, but it's going to be way cheaper to us to pay $5,000 now and be done with it. And the defendant can say, no, I wasn't at fault. It doesn't matter. The insurance company has the right to settle the case.
Yeah.
That is different for a lot of doctors. And there are certain insurance companies, and the largest one in Arizona is one of these, where it requires the doctor's consent to settle. And that can be a real problem.
Yeah.
Even in cases where it seems very obvious, the doctor, and if there is a settlement, they do have to report that to the Board of Medical Examiners.
Yeah.
And that's going to affect their insurance rates, again. And so a lot of times doctors don't want to settle, even when it's a situation where the insurance company is like, the odds are they're going to win this. Well, we probably should settle, but they can refuse.
Yeah.
And so that also is one of the reasons why a lot of these cases get dragged all the way to trial rather than getting, compromised at an earlier stage.
That makes sense. I mean, I'm assuming for some of these doctors, it must feel like public humiliation to a certain extent, right? Like you're being thrown up on stand and you have tens of people following you on that stand, right? On both sides, or I guess mostly on the plaintiff side, saying that you suck at your job, you fucked up, you did something, negligence, like you were a negligent individual. That I think for a lot of doctors that went to school for, like 6 years, whatever it is, and went through all of the bills and the loans and the everything, debt, and then they get told, that they're negligent at their job. That must feel terrible, but at the same time, they are. Some of them. Some of them.
Some of them really are. Yeah, yeah. So I mean, and a lot of people have I mean, if there's just nasty cases too. I mean, they're just really vicious.
I bet they get
crazy,
very like
nasty.
personal too, with both the defense and prosecution going into their personal life and all of that.
Yeah, yeah. Well, so I had this one case, and this just kind of reminded me. I mean, and I don't personally handle medical malpractice cases anymore, but we do associate with other firms, and we get a lot of calls for them. But there was a case that I had, and this was a number of years ago, and it was a situation where a medical instrument had been left in during a surgery. Yeah, a medical instrument, and it was just one of these crazy things too. But where it seemed pretty obvious. I mean, let's just get the case settled. They had to take it out. Let's move on. But I mean, they fought this thing tooth and nail. It was a female physician, and I remember her deposition, and she just came in, just stormed in there, yelling that it was bullshit and this was a ridiculous waste of her time. And I'm like, oh my gosh. Her attorney was just a total jerk. Is still around, still practicing, and he's quite a bit older than me. But anyway, I mean, it was just this horrible experience. Finally got everything calmed down, got the deposition taken, moved on. But this was also a crazy case where they argued that that was not below the standard of care.
Yeah, I was going to say, I mean, she's coming in saying that this is a waste of her time. What about the patient that has to have a second surgery to get out
exactly.
the item you forgot? You just slipped your mind and left a medical instrument in someone's body.
Yeah, and so, what her argument was it's the nurse's fault. But I mean, there are all sorts of protocols about counting instruments and counting everything, and again, I mean, you want to pass it off on the nurses. Well, I mean, you're the doctor who put the thing in there, who was actually using the thing.
Well, I mean, that is a good point, though. Is I'm sure there are a lot of cases out there because, like you said, there's a lot of kind of infrastructure in place to make sure things don't go bad, to make sure that these things don't happen.
Yeah.
And part of that infrastructure is having a big support system of nurses and the anesthesiologists. Like there are a lot of people in the room during these surgeries, and even I'm assuming in general healthcare, like there are a lot of people supervising each other. What does that look like? And especially if there's someone like a nurse who actually does make a mistake, and this situation doesn't seem like it, but a nurse actually does make a mistake, is the doctor still held liable for not, overseeing one of 6 nurses in the room or something like that?
Well, I think it depends on exactly what the situation is and what would a doctor be expected to be cognizant of versus the nurses. Mm-hmm. But I mean, a big metal instrument that the doctor had her hands on, I think I'm not buying that. That was just the nurse who shouldn't have,
So did that settle?
It did settle.
It did settle.
It did settle. Thank goodness. But I'm a little bit surprised. But again, it's one again that is relatively obvious, and so it's a frustrating thing because in a lot of states and in Arizona now, you can't even file a lawsuit without an actual affidavit from a doctor saying that there was negligence, that it breached the standard of care. So that's like a very first step, something that you have to do before you file it.
Seems kind of fair, though.
It is. I mean, at least you definitely have, you have your experts lined up. I mean, it can be, if somebody comes in close to the time frame, it can be difficult, which is another thing. Going back to that statute of limitations, people are always like, oh, I have 2 years, and they want to show up, on day, 1 year and 362 days or something. I mean, you can't do that. I mean, these cases really do involve investigation and getting your ducks in a row, getting your doctors on board for sure.
Yeah, coming in last minute, definitely not the move there. And so if there's someone that does feel like they were a victim of medical malpractice in some type of way, what's kind of, I think in general, right, we always recommend them to call an attorney and get a second look. And most attorneys, if not all of them, are going to be willing to at least take a look at your case and tell you if there's something there. But is there any type of like mental checklist that they should take before, if they're unsure, right? Like they think something happened, the damages are uncomfortable, pretty rough maybe, but they're not sure. Is there a checklist, or what should they be thinking about?
Well, I think the initial thing is, if you have a question, it never hurts to ask. And that's probably why we get so many calls. And there are many times where I'm just, we kind of talk through it and say, I really don't see that. I mean, certainly you could get a second opinion, but I really don't see that it makes sense to go further. And then there are many cases where it does make sense to at least get an opinion, and oftentimes, we have these listservs, and so we'll ask for recommendations of doctors who are willing, in whatever specialty it is, are willing to give opinions. And sometimes you can get like an initial review. The important thing would be, the person wants to make sure that they get their medical records. And oftentimes it's a good idea for the person to get those medical records on their own rather than to wait for an attorney to get them.
It's faster when they get it, right?
Well, it's faster.
And free.
It's free. But the other thing is that red flags go off. Oh, attorneys are asking for it. People get really nervous.
Really?
But when you're asking for your medical records right up front, it's less likely things are going to be deleted or left out or.
Do you think that really does happen?
Absolutely.
Really?
Absolutely. I think so. Back in the day, I think it happened a lot. I think that now that everything is electronic and it's really hard to get away with that, I think that happens less often.
I mean, that's a pretty big accusation there, right? I mean, requesting medical bills and records, that's the first step for any type of injury, car crash, medical malpractice, mass tort, no matter what it is. And so you think there's a lot of those situations where they maybe redact something.
Oh my gosh!
Pull out a page.
Well, back in the day, it makes me feel kind of old. But I mean, we would have these medical records, and we would have like document examiners go in and say, "Look, this ink is not the same.
Wow.
This edition was not made at the same time." And now, I mean, you can do that electronically, certainly. Yeah. But oh my gosh, absolutely.
That's criminal, no?
Yeah, I think potentially it is.
And you're tampering with evidence. There are probably possible evidence at the very least.
Yeah. I mean, and then of course the excuse is, oh, well, I did my notes quickly and then I went back to change it. But again, you went back to change it after an attorney asked for your records. It could be a little bit suspicious. But I would definitely say, get your medical records. An attorney is not going to be able to help you at all unless you or they get the medical records and can take a look at it. And then probably the next step from there is going, again, if it looks like the injury was significant enough to have it make sense to even go start the process, to get another doctor to take a look and give you an opinion on whether you should move forward with it.
So in a lot of these, there's a lot of industries, I think, where there's a lot of tribalism. You see it a lot with like police officers. I think you see it with doctors. I think you see it with attorneys. Like a lot of these fields of work where you feel a little closer with your peers than other fields of work. Do you think that tribalism plays a role in some of these medical malpractice cases or the expert witnesses or insurances and like the places of employment? Like does that feeling ever creep in?
I think to a certain extent. I think that they all hate lawyers. Other than that, I don't know if they have much in common.
Yeah. Well, hey, I mean, a common enemy is a good unifier.
Yeah. And they hate the fact that people are going to come in and second guess their actions. But again, there's a lot of protections for that. I mean, yes, might have an emergency situation, but that's all taken into consideration. And, what does a normal doctor or what does a reasonable doctor do? Yeah. What's the standard of care under all of the specific circumstances? Yes, there's an emergency. Yes, the lights went out. Yes, the generators didn't come. I don't know. I mean, but again, it's going to be what's reasonable under those circumstances.
Yeah.
And to be honest, there's many. I keep saying many today, but there's a lot of malpractice that goes unaddressed because it doesn't. The damages, it could have killed me, but it didn't.
It's in that gray
area. It got caught, or just issues like that. I mean, I've had cases where somebody's come in and they said the doctor prescribed 10 times the amount of the medication I should have had. I took it to the pharmacist. The pharmacist is like, "Whoa, you can't take that. That would kill you if you took it. That's malpractice. That would have killed me." I'm like, it is malpractice, but she didn't have any damages.
And it's pretty clear cut.
And it's very clear cut. And those certain types of circumstances, you can make a complaint with the Board of Medical Examiners. Yeah. You can alert them, that the doctor has done something along these lines. But
do they do anything? Like, is that actually?
In theory, they will investigate. They could censure them. Now, I mean, I would say they, again, if like 50 people say that they're doing this, I mean, they might take a look and say what's going on. I mean, it wasn't just like a typo or an error. If it's maybe this doctor's got some other issues going on that needs to get addressed. But I mean, there are certainly times where that's a lot of times I had told people the best that you can do really is to make a complaint against the doctor. And even if they don't take an action on this, maybe this is the first one. If this continues to happen, then we've got a record there.
And then if that case does pop up and it's anything similar to those complaints, then that's pretty clear cut there as well.
Yeah,
I mean, that's really frustrating. frustrating, I would imagine, as a client, where you go to the pharmacist telling you, yeah, you'd be pretty fucked up if you took this.
Exactly.
And you're getting it from one of the most, who's supposed to be trustworthy people in your life, right? You got your doctor, you got your therapist, and your family. But yeah, and there's nothing you can do about it. I mean, I don't know. That feels a little sticky. I mean, I know you can complain to the board.
And then there's always Google and reviews.
Google reviews.
And,
I
oh my
guess
God,
that probably will do more damage than a
probably.
complaint to the board.
Yeah.
Of a nasty Google review.
Well, but I mean, again, I think a lot of people do now go online to try to get reviews from doctors. I mean, and it may not be the doctor's going to kill you, but just, are they a nice, friendly person? Do they spend time with you? Do you feel confident in their opinions? That kind of thing.
You mentioned earlier how you think sometimes, or it feels like sometimes, how medical malpractice calls will often be just situations of poor bedside manner. Do you think bedside manner and kind of like pleasantries like that are part of standard of care, like that is in that realm?
Again, you could probably have people on both sides.
Yeah, I think you do. It's a very subjective
But I
thing.
would say that the best advice that attorneys could give doctors is be nice and be attentive and be apologetic when things, you can't say, I'm sorry, I screwed up, but, be very sensitive because there are circumstances where it's clear malpractice and big damages, and people are like, well, I don't want to sue the doctor. He did the best he could. He felt bad about it.
Jesus
he was very supportive and blah.
Yeah.
But then it's the doctors who, are insensitive, and bam, they're the ones who are getting, even if they didn't do anything wrong, people are wanting to sue them right and left. So that is, the number one best piece of advice I think any attorney could give a doctor is just be nice, be attentive, be caring, and you're much less likely to get sued, whatever it is you did.
Yeah.
It's kind of crazy, huh?
Yeah, I mean, people don't like suing nice people, right?
Well, they don't, and they don't like suing people when they think that they feel like they really did their best,
Yeah,
even if
it was a genuine mistake.
Yeah.
Yeah, and then you talked about the surgery situations, how there's always risk of complications. There's always risks associated, and sometimes there's just nothing that you can do. I'm assuming that is also kind of a tricky area, and that's where you really have to get in the weeds with it with expert witnesses, because you have to figure out, well, is this actually, could this complication have been avoided? We knew it was possible, but by chance, did the doctor or nurses do something that might have made it more likely, and anything like that?
Yeah, I mean, that can get very nuanced. And then the other thing also that goes to that is the informed consent. And failure to obtain informed consent is malpractice. And so that entails making sure that you explain to the person what the actual risks are and ensuring that they understand that. And you always will have to sign off on this informed consent. But again, it shouldn't just be a quick signature. The doctor should really be explaining, because there are times where, and there are a lot of cases where they say that this surgery was not a surgery that this person should have had. And we talked about that kind of back in many episodes back, where we talked about the guy who was basically doing these unnecessary artery surgeries, right? I mean, and then there's complications. Well, maybe the person doesn't even need the surgery, or maybe, the risks and benefits don't, the benefits don't outweigh the risks. And again, that's a personal opinion. I mean, if you're in, level 4 pain, and you might die, some people are going to say, I don't want to live in level 4 pain. I'm going to take the risk. Is it 1%? Is it 2%?
Yeah.
And then you have to start weighing things. When the pain gets to be worse and worse, if it's a level 10, you're willing to take more risk. But different people have different, have different risk aversions, right? Some people, are willing to take more risks than others, and each person gets to decide that for themselves. And if the doctor is not fairly explaining everything, that's malpractice too.
And get a jury involved as well, where you have to explain all these nuances and try to convince them of these very subjective ideas. I can imagine the struggle there.
Yeah.
I know we kind of have like a shorter show for this week. I wanted to ask, though, is there any medical malpractice cases, experiences, or stories, or maybe stories of peers and what they've gone through that you'd like to share or shed some light on?
Yeah. Well, I was as we were leading up to this show, I was looking around, and I kind of been collecting some articles on different types of medical malpractice cases. And there's one that I thought was interesting because this goes again to when you do when you don't need an expert witness. And there was a recent case actually where a individual had gone through surgery. She was supposed to have her left adrenal gland removed, and the surgeon accidentally removed a portion of her pancreas.
Jesus.
I'm like, okay, maybe anatomy. Did you not get a good grade?
Okay,
there?
to be fair though, is when I do see videos of surgeons doing stuff in the body, it isn't very clear cut in there.
They're not labeled.
No, there's no labels. It's not very clean in there. There's blood and guts fucking everywhere and organs popping out. I mean, it's a very compact space in there.
Okay, that's how it looks to us.
Yeah,
but
fair.
again, this is a doctor who's if he's a surgeon, he's used to digging around in there, and even surgeons are very specialized. I mean, they should know a pancreas from an adrenal gland.
Yeah.
But so this was a case where they brought the lawsuit, and the defense tried to dismiss it because they said, you haven't hired a surgeon expert to say that this fell below the standard of care. And in this case, the judge actually said, you know what? This is obvious enough. It's obvious enough, and that there's a common knowledge exception to the doctrine of res ipsa loquitur, or the common knowledge exception and the doctrine of res ipsa loquitur applies, and you can get before the jury. Now, quite frankly, I think that should have applied to my, metal in the body case,
Probably.
leaving the surgical instrument in there. But in this case, they said that that it would go forward, and so that's so this doctrine. I always remember this from law school. It's res ipsa loquitur, and basically what it means is the thing speaks for itself. So basically, it's obvious.
Yeah.
Like you look at this and you're like, they took out the wrong organ, and kind of it goes back to the situation with amputating the wrong limb.
Yeah.
And I mean, you'd be surprised how many times that has happened. I mean, it's insane.
That's crazy.
Well, and how horrifying is this too? When you're going to have to lose one leg, you wake up and they took off the wrong one. Well, they still have to go back and take off the one that had to go in the first place. So now you have 0 legs.
No, it's insane because it's obviously not a laughing matter, but it is almost so insane that it's something you'd see at a sitcom, right? Like you would see it in Saturday Night Live, where it's like you have these actors coming out. Shane Gillis comes out as doctor, and he's slamming a Bud Light, and he's like, "Oh, I got you got your leg taken care of," and the victim's like, "What about I thought it was the other one." He slams another beer, and he's like, "Oh shit!" Well,
it was not quite like that. But so they one of the things that happens in surgery now, they do these things called timeouts. It's like, okay, because everyone's rushing and doing this and all this. And it's okay, stop. Patient's name, what we're doing, blah blah. And I don't know what all of the other things are, but they have to go through it. And so, for example, with the legs things, I mean, you'll see these pictures where they're right. This leg, not this leg, in markers and stuff, I mean.
Well, also, I mean, even talking about mentioning that the patient's name, I mean, there's a lot of cases where people are on their stomach, right? You're not looking at their face. I would imagine it's not a crazy idea for a folder to get swapped here or there, and then boom, you're working on.
Well, you do have those medical bands on your wrist, and I mean, the theory about that is that you hopefully put the right one on the person, and so you would double check that, and you make sure, yes, this is a man, not a woman, and
Yeah,
you could get
I'm sure there's steps you could take.
You could have some clues to make it a little bit more certain that that's the case. There was actually along those lines, there was this was a really scary one where a woman had gone into a hospital, and I think it was, it was some neurological treatment that she had, and then taken back to the room, and she was put in the wrong room, and then they came in and they gave her open heart surgery because the person who was supposed to be in that room was due for open heart surgery.
Yeah.
I mean, the timeout certainly failed in that situation.
Yeah. And being the nurse that put that person in the wrong room, your stomach has to drop a little bit when next hour you walk by and there's open heart surgery going on.
Yeah.
Wait.
Well, and I guess it was during the surgery when somehow somebody was like, "Where the heck is my patient?" But I mean, just having had the surgery, increases her risks for future problems and that sort of surgery.
She sprained her ankle. I don't understand why we're doing open.
Why she has a big chest scar
We're cracking
now.
open her sternum with the sprained ankle. I don't see this quite yet.
Yeah, no, crazy stuff. Well, and then there's these, oh man, there's a bunch of these stories that I don't know if you've heard of recently in the news where like an in vitro fertilization or IUI, where the doctors are using their own sperm.
Oh, yeah.
A lot of those.
There's a Netflix documentary on that.
Right. There's those cases. And then there was a case that got a lot of news a few years back where the facility had mixed up the sperm for an in vitro fertilization. And then when the baby was born, it was a completely different race than the parents. And they were like...
Jesus Christ.
But it would have taken longer to figure it out.
Yeah, they're lucky it was a different race. Otherwise, they might have never found out.
But it was like, okay.
Yeah.
This is not my husband's sperm.
Yeah, the husband's looking at the wife a little weird, like, oh, what have you been doing this last... What were you doing 11 months ago, actually?
Yeah, but bad stuff like that. Cases where this was a sad one where a girl was getting an organ transplant and they didn't type her blood and they gave her and the organ was rejected.
She gave him the wrong. Okay. So I do want to like throw this out there as well, because I think it's pretty scary when you hear these stories of very innocent people, right, coming in for normal procedures and normal concerns, and then having kind of the worst of the worst happen to them out of their control unknowingly, doctors confused, nurses confused. How can someone, if someone's worried about this, how can they avoid it? Like, what are the best actions as an individual, if you're in the hospital, if you're going to see the doctor, if you're getting x-rays, to avoid any type of malpractice?
Honestly, the absolute best thing that they can do is to have an advocate with you, have family members, have a friend, have somebody with you, and to ask questions. I can remember, just some kind of, it just pops into my head, and it was kind of not a major issue, but when I had my heart surgery so many years ago, the doctor came in and was like, the phlebotomist came in and, we're going to do a blood gas test. I was like, why are we doing a blood gas test? And just like, well, I don't know. And then came back in and said, you're right, we didn't need it. And again, it's one of those situations where it's apparently a very painful test. I haven't had it, luckily. But I didn't understand, it didn't make sense with what was going on. And so I think just being sure to ask questions, I think that's probably the best thing that you can do.
Yeah, maybe second opinions too.
Oh yeah. Okay. So and that's for sure. If you're going to go into a surgery, definitely. So there was another case actually was one of these that came up was a woman who had been told that she had breast cancer. They did a bilateral mastectomy, and then they were like, oh no, she didn't have breast cancer.
They already took one over.
And they both, yeah.
Both, wow.
And so again, before you have any major surgery, you want to get a second opinion, and not just any old second opinion. For example, when I had to have my surgery all those years ago, the insurance company required a second opinion because it was going to be very expensive.
Yeah.
And so they wanted another doctor to take a look. But when I went in for that second opinion, basically they just said, yep, signed off. And I was like, whoa, hey,
it's unsettling.
It was a little bit unsettling. And I said, well, and he's like, well, here's what I'm doing. I'm looking at this, I'm looking at that. But
make them double check, make them explain it, make them go through it, because maybe they are really confident, but they're not going to catch their mistake unless you kind of throw it in their face. Yeah.
Well, absolutely. And I think, and the other thing is also getting the risks and benefits from another doctor as well. Not just, is this a surgery that's advisable, but also, do I really need it? What's the downside if I don't have it? What are any other options? Because there are some people who are more surgery happy than others. And kind of on that note too, I would say, I wouldn't, you go to Dr. Smith and say, who should I get a second opinion from? No, don't get it from his buddy next door. Do your own research and find an unbiased, completely different doctor to.
Well, what's crazy too is that you'd assume. I know from not necessarily experience, but I know just from being told that second opinion is very important. But I think a lot of people would assume, like, what's the point of a second opinion? Because science is science, medicine is medicine, right? Mm-hmm. Like, if this condition or if this surgery, if this prescription is necessary, and this doctor believes it, like, didn't they and they're all the same type of doctor. They all went to school for the same type of thing. Shouldn't they be on the same page? But it's just not like that at all.
Yeah.
The world of medicine isn't like that at all. I mean, clearly from the last 55 minutes we've been talking, there's a lot of subjective aspects of medicine, of not science per se, but of like, how to actually go the necessary steps and safety steps you have to take in these situations.
Yeah, yeah. Well, kind of just jumping back to what you can do. I mean, the other thing that I was just thinking is, I mean, you kind of have to be the squeaky wheel. You have to be somebody who complains. I mean, because you'll see these cases too, where somebody is, for example, in the emergency room and they end up dying in the emergency room because they never get back for treatment because they don't think it's significant enough. Yeah. I mean, then that's again someplace where a situation where you need to have an advocate. This person's getting sick, or they're getting sick or not, before they drop dead. And then another situation is, you see people die of septic shock, where an infection basically takes over your body. And so people get infections. We all get infections all the time. But I mean, things like a urinary tract infection, you can die from it. I mean, I actually had a case, which I'll talk about briefly in a second, but where a pregnant woman died of a urinary tract infection. And there was a recent verdict in a similar situation where a young man, I think he was in his 20s or early 30s, was admitted and had a urinary tract infection. They figured it wasn't a big deal, and he ultimately ended up dying from it because they didn't treat it quickly enough.
Yeah.
So again, somebody's getting sicker, and they're not getting the attention that they need to have. That's really, really pretty critical. And in the case that I had, this was so sad. It was a young woman who was pregnant, and oftentimes when you're pregnant, you get UTIs. And she went to the hospital, significant fever and that sort of thing. And they called the doctor who was on call, and he was a real dick. I mean, he screamed and yelled, "I'm having dinner, don't bother me." I mean, they called him multiple times and he never came in. And by the time he did come in, she was so incredibly sick that she ended up dying and lost the
So
baby.
would that be malpractice?
Huge malpractice.
Huge malpractice because he's on call and he needs to be.
Yeah, that's his job.
That's his job. To drop dinner and actually come.
Exactly.
Do his job. Yeah.
Exactly. Yeah. So definitely having somebody who's paying attention to you and advocating for you, I think is pretty critical.
Yeah, I think those are two biggest things: is make sure someone comes with you to these appointments and helping you. Just keep track of everything and ask those questions. Be that squeaky wheel, and then always get a second opinion as well. I mean, if you're getting something as serious as a surgery, they're going in your body, then it's better safe than sorry of at least going to another doctor and seeing what they think.
Yeah,
or at least hearing the pros and cons of it from a different source, because that might open your eyes up and maybe you decide it's not something that's worth the risk or worth the trouble.
Yeah. Well, kind of on the note of babies and cases in the news, there's like a really, really traumatic one, and this has been playing out now actually for a while. But this case involved a pregnant mother who was giving birth. And they were having some difficulty during the birth. His shoulder was stuck. And rather than do an emergency C-section, they used forceps and basically forcefully removed the baby. And the baby was decapitated.
Jesus Christ.
Right?
I mean, that is gruesome.
What's horrifying. It's completely horrifying. But then it gets crazier from there. What happened? So there's a big debate. The doctors insist that the baby died in utero. And they say, hey, the baby died in utero, and at that point, we were trying to save the mother's life by getting it out by any means necessary. We didn't have time to perform a cesarean, so we just got the baby out, whatever happened to the baby. So that's their argument. And this happened in Georgia. So then the couple actually hires a medical examiner to perform an autopsy on the baby. And the result, actually, the medical examiner determined that it was a homicide, because the medical examiner determined that the death was caused by severing the baby's spinal cord. And so basically it proved that what the hospital was saying was not accurate, that it was caused by human conduct in this, forceful trying to assist the baby coming up.
And that's more than medical malpractice. That is homicide.
Well, that's potentially criminal, yeah. But then it gets even worse. Well, I don't know if it's even worse, but I mean, this is just like insult to injury, this whole situation, where it's been in the news actually for quite a while now. Then this medical examiner who was hired puts videos on Instagram of this decapitated baby.
How would photos, videos, like, is it? How that's against
all realms of decency.
I mean, I just
right?
can't even imagine, right? Like the scene that's already taking place, like a head popping off. These babies are very fragile. Like I can see how this happens. They're fresh out of the womb, the head pops off. I have the Heads Will Roll song going in my head right now. Untasteful, maybe. But
well, yes, but so it's based, and how this happened is that relatives saw these graphic images of the baby on this doctor's Instagram.
Wait,
page.
The doctor posted on his Instagram page,
right? So the medical examiner who's is examining the baby.
Yeah.
is posting this on his Instagram page.
Oh, so it's a medical examiner. It's not the doctor.
Oh
that
God,
pulled it
no.
out.
The
That's
doctor's probably hiding in a hole at some point.
I was like,
just waiting to.
Already you fuck up this bad,
Oh, God,
and you take pictures of it and post it, advertising your services.
No, but I mean, like how horrifying, is this? And what his argument was that for educational purposes, he was posting, these images, but they had not given permission. He said, well, he didn't use the name, but I mean, how many decapitated babies?
Yeah, I don't think there's a long list.
But yeah, so he was arguing it was for educational purposes, and that he posts on his Instagram pages, different videos about him performing. People. Well, yeah, when he's
it sounds kind of
performing
interesting.
Autopsies, and and I could say, well, this is where the bullet entered, and here's how I can tell for certain things. But I mean, it was, and again, because it was the head, they could identify it as their child.
Jesus. So is this still on trial?
No, actually, he was found responsible for posting the photos. So that was a civil case that's done. But he didn't respond in court. So we don't know how much they're going to be awarded, but they found him responsible. Wow. Then they will do a bench trial to determine the actual damages that will be awarded. But as far as the homicide, I don't know where that's going yet. That was a very recent determination. They were trying to investigate because, again, if the baby had died, and they were just trying to extricate the baby before it affected the mom, that would be a different story. Mm-hmm. But yeah, I mean, just a real nightmare case. And I would say, of course they're going to have to hire expert witnesses, but it feels like res ipsa loquitur to me that you shouldn't decapitate a baby during birth.
Yeah. I mean, I'm assuming it's probably not in the handbook, but it's probably a subset somewhere in there.
Yeah. So.
Well, crazy story. I can't even imagine something like that happening. I mean, another situation where it almost sounds like it's like out of a movie, right? Like that's just so insane. You can't imagine it happening in real life.
Yeah.
I think we are going to close out here. Thank you everyone for tuning in and hanging out with us on our 50th show. Woo-hoo. 50th anniversary. Another 2 shows, and that will be a full year anniversary of us recording. I hope all of you have been enjoying our show. We enjoy filming for you. If you have any questions or concerns, feel free to throw them in the comment section wherever you're watching this: YouTube, TikTok, Instagram, Facebook. We're always keeping an eye out. We're always watching it. And maybe you don't want to throw it out in the comment section. You want it to be a little bit more private. We understand. You can always throw it in the DMs. We're keeping an eye on that. Or email us at podcast@showeredlaw.com. Stories, experiences, questions, anything like that you'd like us to discuss, send them over, and we're more than happy to cover them on the show. With that being said, though, I think we're going to call it. We're going to head to this street fair and have a good weekend, and I hope all of you have a great week and weekend. We'll see you next week, same day, same time.
Prioritizing profits.
Dangerous drug and product cases.